Years ago, they called Bayer aspirin.
Bayer is the wonder drug that works wonders.
Now it seems there is a diabetes medication that everyone wants to use for other purposes than what they intended it for. It's called Ozempic or Wegovy, same med. Scientists keep finding new uses for it. Patients are using it to lose weight. And now it's helping people with the most common way that a heart can fail. We are joined by Dr. Fahmi Farah from Bentley Heart Health in the KRLD Zoom room. So how does Ozempic help with heart function?
Yeah, so Ozempic, as you mentioned, it is a diabetes medication. It falls under a category of medications called semaglutides, and those are known to help heart function for those patients who have diagnosis of congestive heart failure. So if their heart pump is not functioning adequately and it's not pumping well, then this class of medications help improve that function over time.
It's become very popular and very hip to use Ozempic to lose weight. Have doctors always known about this particular factor in Ozempic, that it can be used to help heart health?
Yes, we've known that. And we've also known the weight loss benefits of this particular drug. For a while, as you know, before it became FDA approved for weight loss, it was being used as, like off-label by a lot of physicians. And we ran into the problem of the medication running out because too many people were using for weight loss. And so our diabetic patients were kind of missing out. So now it is approved, and it's a really great medicine for both.
Are there still shortages of it for the purpose that it's originally intended?
I believe the shortage has improved by quite a bit. We're not in that crisis anymore, so it is more available now.
How is it the scientists keep finding new uses for old medications? We saw the classic example of what Viagra used to be used for, and now it's being used for what it's being used for now.
Yes, over time, as we use it, we see all the additional benefits of the medicine. Although the drug was intended for diabetes only, there's other research being done. For example, I'm going to go back to the heart failure aspect of things. Like, they've looked at that class of medication, and studies have shown that it has significant benefits, and so that's why we now use it for our heart failure patients. So it really is just, even though it was intended for something else, we go back and do research and see what else can it be used for.
Yeah, I keep seeing new things that it's being used for. It's now being touted as a way to get off of alcohol and to avoid gambling and everything else like that. All of a sudden, this really is a wonder drug, it seems.
It is a great drug, I will say, for so many classes of usage, of course, for our diabetic patients, for weight loss, and for our heart failure patients.
Is this a case where people are trying to get shortcuts to get away from the hard work of losing weight and then improving their heart health as well?
I don't believe that there is any such thing as a shortcut when it comes to losing weight and being heart healthy. It definitely is something that, accelerates that process, and it almost acts as a catalyst to that process. But there's no shortcut. You still have to maintain a healthy diet. You still have to do your part of going to the gym and exercising. So you can't take those, basic elements off. This is just an added benefit.
That's Dr. Fahmi Farah from Bentley Heart Health.